have this problem of healthcare costs kind of going out of control so that pretty soon we can't afford anything else but our healthcare costs.
People do avoid healthcare a lot of times because they can't afford it. Prescription medication, a lot of times, you have to pay your bill before you get your medication.
We talked about capping, but that becomes very difficult because there are so many variables. And even if we were to tie it to the index and inflation and say we would only allow this much increase, but more and more treatments come up and they're costly, and how do we stop that?
But if the cost to me just go visit the doctor is, manageable, then yeah, of course I'm gonna go often. But if, like you say, you go and it's gonna cost you $200-300 and your deductible is, $200-300, I'm not gonna go till I can't, till I need to go.
I'm a medical oncologist, and there's not a single drug coming on the market in our field for less than $4,000 a month. And so, and some of the drugs have a response rate, let's say, of 10%. So if you treat 100 patients for 3 months to see who's going to respond, you've got $15,000 into 100 patients, or $1.5 million into 100 patients, of which 10 of them may live 2 months or 3 months longer. So in oncology, I'd hope that we're going to get more sensible about the drugs we're using sometimes.
The demographic graphs will show you that the huge cost, geriatric cost, comes in the last 2 years of life. Huge. And those are all of the same kind of morbidities that increase exponentially as you get to that window. And so healthy lifestyles and all that aside, that's nice, but you're still going to have a huge cost toward the end, and we need to really work on that.
How much of our healthcare dollar is being paid on non-treatment related expenses? And for those of you that are providers, the billing activity and the administrative overhead activity. So one of the things we said was, can we achieve the goal of having 90% of our healthcare dollars going to treatment? Is that possible?
We're talking about a competitive marketplace, and how do you choose if you can't tell how much different people cost? So that'll drive the cost down. If something is less expensive, and actually if you can tell who is good, and if you can compare those two things, that drives costs down considerably, and it also drives quality of care up.
Probably kind of need to have sort of a campaign about this is your responsibility to reduce overall healthcare costs, and this is what you can do, as a community member to help us achieve that goal of reduced costs. And so don't use emergency care. Go to have established primary care. And here's resources. Here are clinics that those kind of things. Because you're right. You have to educate folks in order for them to really take those actions.
Ensuring the health of our community is going to take all of our agencies working together. And how can we not duplicate efforts, but build upon each other and make sure that all of our community members have access and that it becomes a long-term investment for our community working forward.